Hello and welcome once more to my channel, Background Health. On today's episode, I'll be talking about high blood pressure or hypertension. What is high blood pressure? Or even what is blood pressure? The blood pressure is the amount of pressure inside your blood vessels. Your blood vessels are like a series of tubes running throughout your body, various sizes, some very big, some very small, some very microscopic. The sole purpose is to convey blood to different organs so that it can get oxygen and nutrients. So, like the vehicle you drive, or your bicycle or motorcycle, or even a charged balloon, there's a certain amount of pressure that is designed for smooth operation of either one of those vehicles or even a balloon. When you have too much pressure, it pops or it damages and there's no smooth ride. The same thing happens to humans. When you have consistently high blood pressure or sudden severe rise in blood pressure, something catastrophic or serious may happen. Now, how is high blood pressure defined? There are two sets of numbers, the top number called systolic and the bottom number called diastolic. The American Joint Commission for High Blood Pressure defined high blood pressure as the top number, meaning systolic number greater than 130, and then the diastolic number, lower number, greater than 80. Now, there's some periods where you can have something called borderline hypertension. Also know that hypertension comes in stages graded according to the severity. So you should be aware of that as you look up high blood pressure on the internet. The next question is high blood pressure or hypertension dangerous or harmful to me? Absolutely. The longer you have high blood pressure, the more internal organs your body is undergoing, ranging from hardening of your blood vessels to congestive heart failure to stroke, etc. With respect to the heart, I want you to see this scenario. Think about it like you're going to the gym and you're lifting weight. At first, you start with a small amount of weight. Over time, somebody keep adding weight and you keep pushing and you keep pushing and you keep pushing harder and harder and harder. Eventually, as the weight goes harder and you push for longer period of time, your muscle begin to get weaker and weaker and weaker, and sooner or later you drop those weight and you're no longer able to push up those weight. That's called congestive heart failure. You may even drop it, or some other things may happen. So that's one of the harms. Of course, in your eye, high blood pressure can cause bleeding, called flame hemorrhages and blindness. You should know that brain stroke, in the kidney failure, etc. Next question is, are there symptoms related to high blood pressure? Majority of people who have high blood pressure do not have any symptom whatsoever. However, when blood pressure is severely elevated or suddenly elevated beyond the normal range, especially in the 170, 180 and above for systolic, you may have headache, you may have nausea or vomiting, you may feel confused, tiredness, you may also have chest pain or shortness of breath. So those are some of the symptoms. But if you have to wait to have those symptoms, it may already be too late for you. So don't wait to have symptoms. Also remember that the absence of symptom does not mean the absence of high blood pressure. The absence of symptom does not also mean the absence of damage. Now, is high blood pressure curable? No, high BP is not curable. So when you have high blood pressure, all that the doctors can do is treat it, manage it, to put you on medication to put your blood pressure in the normal range. But if you think that you take medications for a few days and you go back the next time and see a doctor, hey, your blood pressure is in the normal range, and you suddenly stop taking medication, you're mistaken. Next question is, can I stop taking my medications? I just mentioned something about that. However, there may be situations in which your doctor may decide that your blood pressure is doing so well that he or she may decide to gradually taper you off of your blood pressure medications. However, when that is done, that's a good thing. But that does not mean that you should stop taking your medication or stop having your blood pressure checked. You should still see your doctor. You should periodically have your blood pressure measured. So that's something to know about that. At some time in the future, he or she may resume you on your blood pressure medication once the BPs begin to rise again. Next question, what is the best time to measure my BP? Some people, when they go to see a doctor, they are very anxious, they are fearful of doctors, and their blood pressure rises. That's called white coat hypertension. For most human beings, when we are in a stressful environment, our BP is supposed to rise. If you find your blood pressure is usually high in the presence of doctors but normal at home, then you may need something called ambulatory BP monitoring. Simply put, that means you may have to buy a blood pressure measuring device so that you can take your blood pressure at home on your own, monitor your blood pressure, keep record. Some of those devices have internal digital record. Some you have to take pen, write it down, and when you see your doctor, you hand them over and say, here's a record of my blood pressure at home. Also, if you check your blood pressure only when you are stressed, it may not be reflective of real severe or true hypertension. So be aware of that. Sometimes after you slept, when you are fully relaxed, that's the best time to check your blood pressure. Can I fool my doctors with my blood pressure or medication? Absolutely. Many people do this. Imagine you are diagnosed with high blood pressure, you're taking medications, you suddenly decide to stop taking your medication, you go for months or weeks not taking your medication. All of a sudden, you realize, oh, I have an appointment with my doctor. And a few days before you see your doctor, you start taking your medications. When you go to see your doctor, he or she say, oh, congratulations, your blood pressure looks very good. Keep up the good work. Then you leave the doctor's office and you stop taking the medicine again. You have fooled your doctor into thinking your blood pressure is controlled. You have denied him or her opportunity to find out why you're not taking it and see what can be done. So don't do that. You have fooling your doctor is doing injustice to yourself. Next question is, are there some lifestyle changes that I can do to help my blood pressure? Yes, you can exercise, you can diet, you can lose weight, you can limit the amount of alcohol that you drink, you can also limit the amount of salt in your diet. Um, Lastly, are there some monitoring that I should do? Yes. If you have high blood pressure, you should have your kidney test done at least once every 1 to 2 years. Creatinine is called. You should have eye exams. And at least every 5 to 10 years, you should have an EKG. And if you're having symptoms such as chest pain, shortness of breath, etc., you may need to see a cardiologist for further testing. Thank you. Please pass this video along to save life. Don't forget to subscribe to my channel and let's continue in this journey to save life together.